Hi everyone, my name is Mohammed Salman, and this is my presentation on health in Aboriginal and Torres Strait Islander children and youth. According to the health plan document developed by the Commonwealth of Australia 2013, more than 50% of the Indigenous population are in fact the youth population. There's a high rate of infant mortality compared to the non-Indigenous populations, and this is commonly due to poor antenatal care, sudden infant death syndrome, congenital malformations, low birth weights. And if we go beyond the infant age group, let's say 1 to 4 or 5 to 14 years of age group for children, we've seen that more than 50% die because of injury and poisoning. And then if you go to the adolescence age group, 65% of the deaths are actually attributing to suicide, transport accidents, and assaults. According to the data collected between 2008 and 2012, the highest frequency of death in children from 1 to 4 years of age is caused by external injuries and poisoning. The most common cause of death in infants is due to maternal health issues. The second leading cause of death in infants is in fact due to sudden infant death syndrome and other ill-defined conditions. And after that again, it's congenital malformations being the third leading cause of death in infants. And and then you have congenital malformations and sudden infant death syndrome and other diseases, including infectious diseases, contributing to high percentage of death. In order to understand the cause of these health inequalities amongst the Indigenous children and youth, we must examine the complex relationships between various factors resulting from socio-economic and cultural determinants. Now, according to the Health Ministers Advisory Council 2012, the Aboriginal and Torres Strait Islander adults are less likely to smoke if they have completed Year 12 education, are employed, and have higher income. Other example is that rheumatic heart disease and ear infections are associated with poverty and poor living conditions. Now, according to the Prime Minister's report on closing the gap for 2017, we must also consider the cultural determinants as they serve to be a crucial link to the health and well-being of the Aboriginal and Torres Strait Islander children. Now, we are talking about the cultural awareness, the strengths of cultural identity and values amongst the school students, and the cultural connection with their land. Failure in considering these cultural perspectives may explain the persisting problem of these health inequalities amongst the Indigenous children and youth. The three strategies discussed later will reflect these culture-based models. So if we go 50 years back, let's say we are starting from 1967, we can really appreciate the numerous amount of health policies and strategies and initiatives that have come along and tried to get the health aspect of the Indigenous population on the agenda. The social justice report, which was published in 2005, really picked up and highlighted those areas. And then later on in 2008, there was a national apology that led to the introduction of the Indigenous community and all sectors of the government to work together in order to reduce the gap of life expectancy and mortality between the non-Indigenous and the Indigenous communities. Now, Closing the Gap campaign served as a major gateway for the Aboriginal and Torres Strait Islander people to work with all levels of the government. So it was a major agreement all over Australia. There was also an agreement that these services that are being implemented will be on a regular basis evaluated and being presented in different reports. So here are the 6 targets of closing the gap, and we can really appreciate that most of the targets are attributing to children's health and the health of the adolescents. Now, Black and Richards 2009 argued that these targets may not be a true representation of the Aboriginal and Torres Strait Islander people. This suggests that it's more like considering these population groups as a numerical population and not as a society. So it's not taking into account of the social and the cultural dynamics that exist between different communities. And this is the issue that has been there for quite some time, and it's been brought into spotlight quite recently. Well, the Department of Health of 2013, they mention it that the Aboriginal and Torres Strait Islander health is viewed in a holistic context that encompasses mental health, physical, cultural, and spiritual health. Land is central to well-being, and when harmony of these interrelations is disrupted, the Aboriginal and Torres Strait Islander ill health will persist. The Indigenous Early Childhood Developments has interventions that can improve health outcomes of children at a much earlier age. That also includes maternal health. Now, the six elements being involved here is the antenatal care, the maternal substance use, low birth weight babies, infant mortality, sexually transmitted infection rates, hospitalization of children who are under age of 5. So here are the three main areas of the strategy. The first one involves that there are at least 35 children and family centers established, have antenatal care, child and maternal health, parenting, and early learning services all integrated to have a continuity in the care, and also ensure that parents are actively involved in children's development, and this is done through various health promotion and counseling programs. And the second part involves that there's increased education to young mothers on sexual and reproductive health to actually reduce chances of early pregnancy. And the last bit would be to increase the uptake of health checks amongst children, and also not only primary care but also include hospital settings for continuous antenatal care. So some of the strengths are that this strategy really enhances the culture and their linguistic relevance. It empowers the indigenous people to become resilient members of the community. It also brings in different partnerships across different organizations to bring a large scale improvement in the community. The main issues about this strategy is that there's a requirement of a local leader that should be trusted and respected by the different communities. The funding organizations need to have patience and provide consistent funding in order to see improvements. There is low availability of qualified staff in rural and remote areas, which then brings up the issue of attracting and retaining workforce. The suicide prevention strategy, it acknowledges that the high rates of suicide attribute to the social, economic, and historic determinants that impact the emotional well-being and the mental health. This strategy really works to building the capacity and strength of the Aboriginal members by providing accessible community programs on suicide and prevention skills and learning and providing language skills, having effective surveillance programs to really recognize people exhibiting risky behaviors for suicide, partnering with schools and different agencies to provide short and long term interventions, and providing adequate response systems for bereavement of those who are affected by suicide. In terms of building resilience, they've also included culture based community activities, counseling services, and therapeutic support, and also included the partnerships with appropriate clinical services. They've also again included the culture perspective to accessing the emergency and special services, and also include the partnerships with the community services in terms of accessibility to mental health issues and substance misuse. Another main thing is to identify children exhibiting these risky behaviors and then having the workforce to really address those areas in a very culturally appropriate manner. People who are actually exposed to such strategy have in fact shown increased knowledge of risk behaviors and reduced suicidal behaviors, and they're choosing to have more protective behaviors. And the suicidal prevention strategies may be difficult to implement in terms of considering the cultural appropriateness. Again, there's more requirement for trained workforce, and the school partnerships really are helpful, but they need to measure the effectiveness of these partnerships in terms of suicidal behaviors. So, with regards to the mental health and social and emotional well being, this strategy really picks up from the background of unresolved transgenerational trauma related to forced removal from family, loss of identity, poor economic development, and limited capital. And these sort of translate into 9 principles. And from these 9 principles, they have implemented various strategies. Some of them highlighted here include parenting programs, family programs to increase parents' participation for the children, including fathers, more on leadership and resilience of the community, and also interesting the drumbeat program to promote education students who are feeling alienated from the schools, and also providing counseling services to kids. So some of the good things about the strategies, it has improved communication skills amongst the youth, reduction in intergenerational effects of past events, also helped in reduction in risk behaviors of amongst children, and reduction in trauma-related symptoms like post-traumatic stress disorder, anxiety, and depression. Now, the issues with the strategies again that it requires continuous funding, more investment for culturally appropriate family and based programs. There's a poor evaluation process, on finding the perceptions of community and reasons for not achieving the targets. Uh, Also, there are unmet needs of holistic and integrated services. More focus is required on cultural determinants, addressing racism, and also a greater focus on improving quality of services. So, according to my research, I agree with Prime Minister's statement that we are still not on track. And this again brings to the issue of funding arrangements and the effectiveness of evaluation processes and making sure that the data being collected is a true representation of the Aboriginal and Torres Strait Islander communities. This also again brings the issue of changing the focus from the social aspects to the cultural perspectives. And this is to really recognize the holistic aspect of the Aboriginal and Torres Strait Islander population and not just basing assumptions or measurements on a numerical value of the population. Thanks for watching the video. I've provided my references in the comments below. Thanks.